this claim area, what about access and with this Part D reform or with this maximum that patients have to pay? Like, usually they will pay first month, second month, and then it gets better. So are you seeing or are you choosing any of the drugs based on that? Are you seeing differences in access, how patients, or co-pays, or how you're getting access to this patient, depending on what kind of drug are you using?
So you're talking about the Inflation Reduction Act, which kind of caps out-of-pocket expense for these patients.
Exactly, it's like a limit.
Yeah, so it was $2,500. I think it's down to $2,000 a year now. Mm-hmm. So from my perspective, I haven't modified my drug choice based on that, but it's a big win for our patients, right? Because they meet that ceiling very, very quickly because these are expensive therapeutics. So I think it actually opens up access, if anything, as opposed to narrows it. Yeah. But it doesn't impact my choice of therapeutic per se. But I think it's a big win for our patients. Most of these folks are, as you know, older, fixed incomes, and they're oftentimes don't meet the income thresholds for free drug, and they're kind of in that gray zone that if they had to pay all this out of pocket, it would potentially bankrupt them. So the IRA to me is a big win for our patients.
Yeah, and it allows them to pay over time via the smoothing too, which is nice. It can be a lump sum or over multiple months.
Exactly.
It kind of gave us all the options back. But previously we were limited sometimes. Yeah, so it was great.
And so actually it's the other way around. Now we have all the options. Before we having to choose, and now actually we can have this. We could go and move on this like the entire night here with lots of questions. I still have a lot of questions, but at some point we have to finish this. So I would like from you some final thoughts about what's happening and maybe some thoughts for the future, what we expect for advanced prostate cancer. I think we're getting much better. I think the urology community is getting much better with that. And overall, we have new drugs, as you said, a lot of things coming in, genetics. Maybe we're going to have some personalized medicine, which is still lacking in prostate cancer. I think this will get better, I'm pretty sure. But some final thoughts about what we said today.
Well, one, thank you for having me. It was a pleasure being here. Secondly, I think it's an exciting time for patients with advanced prostate cancer, and I'm excited as we go forward that we're going to have markers, that are going to drive our treatment decision making in this patient population, and specifically around treatment intensification and de-intensification in these folks, and help us hopefully make better decisions. And more so in the de-intensification. When can we back off in this patient population? Right? When can we take our foot off the gas? That is going to be a huge quality of life. It's not sacrificing survival, in this group of folks. So that to me is a really big unmet need that hopefully we'll have some better data to support in the coming years.
That's a great point, Gordon. Yeah, I totally agree. I mean, I think it's hard to say, what the best part about prostate cancer moving forward is, but it's an exciting time for our patients. And I tell my patients that every day. I say, listen, your treatment today is going to be so much different than it is 5 years from now. And we're going to keep working towards making this a chronic disease for you. And because we are doing so much better and we manage it so much better. So I try to give a lot of reassurance that as urologists, I'm very proud of where we're moving. So it's great.
One, thank you for having me. Listening to all of you speak, I've learned probably more than I've contributed tonight. So that's wonderful. But I think, as Gordon said earlier, we're going to be treating these patients earlier and earlier. Like what's coming in the localized disease space? Will that maybe allow us to de-intensify, or what is that going to add to the back end of these patients' lives? I think that's going to be really, really exciting. And we're going to hopefully start to figure that out in the next 12 to 18 months.
That's great. I learned a lot today. And thank you for listening to us here at the AUA 2025 GU Oncology Now. And thank you again, guys.